Welcome to this video. My name is Christiana Mausi Sayra. I'm a public health practitioner. Now, whenever you are monitoring your blood pressure or when you get your blood pressure checked, which of the numbers is most important? Is it the first one? Is it the top number? Let's look at this. Is it the top number, which is known as the systolic blood pressure, or the down number, or the bottom number, which is known as the diastolic blood pressure? Which of them is the most important? Now, both numbers are very important in the diagnosis and treatment of high blood pressure. However, your doctor primarily focuses on the top number, which is known as the systolic blood pressure. And the systolic blood pressure, or the top number, is the pressure that is exerted on your arteries as your heart contracts or as your heart squeezes to push blood to the rest of your body. So as the heart contracts and push the blood out of the heart to the rest of your body, the pressure that it exerts on your arteries, that is the systolic blood pressure, and that is the pressure, the number that is most important when it comes to diagnosing and treating high blood pressure. Now, the reason why the systolic or the top number is the most important is because a higher systolic blood pressure or a higher top number, this one, is more related to a higher risk of you developing a heart disease and stroke compared to a high diastolic BP. So if this BP, the top one, is high, it is alarming and it has to be managed promptly. And note that the difference in the risk is more related to the force or the pressure that is exerted, or the pressure the contracting heart puts on your arteries, your blood vessels, as it contracts, as it pushes blood to the rest of the body. So that is where the focus is. So for example, if you are somebody who has been eating a lot of high fatty food, you are eating foods that are high in cholesterol, and eventually the cholesterol clogs your arteries. What it means is that your artery has become narrow. So in your case, your heart will need to contract more stronger. And as the heart contracts more stronger, in order to be able to push the blood through your artery, because your artery has been blocked, partly by what? The cholesterol. So the heart will have to contract harder, and that will increase the pressure that it will exert on your artery or your blood vessels. So you will notice that your blood pressure, when it is checked, it will be high. The systolic will be very high because your heart is facing some resistance due to your lifestyle. Or if you drink a lot of alcohol, it will lead to what? Accumulation of bad fats, LDL. And this will clog your blood vessels and narrow your blood vessels. And when that happens, your blood pressure will go up because your heart needs to contract harder because there is a blockage. It's just like pumping water. When you are pumping water and you are pumping and there is a blockage, or the tube or the hose you are using, there is something blocking the hose, you realize that you need more stronger pressure to be able to flush it out or to be able to move past it. And in the case of your arteries, if your the fat or the cholesterol that is blocking the artery, if it dislodges or it removes, it means it will circulate with the blood that is moving, and it will go and block another artery which is smaller. So when that happens, it means the blood supply to other the parts of the body that small artery is supposed to supply will be reduced or blocked completely. And that could lead to so many complications. That is what happens and leads to stroke when the clot moves to your brain So please, let's take note of this and let's check your blood pressure. If you have never checked it before, go check your blood pressure. Go to any pharmacy or walk into any health facility, the OPD, and then get your blood pressure checked. Do that regularly, and then you note your average blood pressure. So you know that, okay, my blood pressure is normally around this. Hypertension is a silent killer. Do you know why it is a silent killer? That is because you may have high blood pressure and you may not know. By the time you know, it would have caused havoc. It would have caused complications already. And a common one is stroke. So if you have high blood pressure and you didn't know, then all of a sudden you are somewhere, you collapse, and then they rush you, it is stroke. By that time, you would have, some damage has been caused already. So please remember this: blood pressure that is 140/90 or more is hypertension, high BP. This should be managed by your doctor. If your blood pressure is above 140/90, please check with your doctor. Get help as soon as possible. It doesn't matter whether you are young, you are in your 20s, you think you are not old. No, please get your blood pressure checked. And if your blood pressure is 90, 60 or below, it means hypotension or low BP. And as I mentioned in my previous video, the low BP usually is not a problem, just that you are at a risk of fainting or feeling dizzy. And commonly too, this could be a sign of any underlying health problem. So it's also good to get that checked also. So thank you, and please get your blood pressure checked. Thank you. Bye bye.